There are a number of areas in breast cancer that we're working on, and generally what we've been studying are alterations that occur in patients' tumors and trying to determine whether these genetic alterations can give us some information on how a patient is likely to do in terms of clinical outcome or response to therapy. We really want to be able to identify characteristics that will help us in terms of treatment of patients and identifying new genes or targets for therapy. When we study the tumors from these women, we often have very large studies and we have to study a large number of specimens. And so this has required some new technology, some new equipment, and through donor support we've been able to purchase that equipment, which we wouldn't have been able to do so easily through our grant funding. Together we are in motion for a cure.
What I have been doing research in, what I'm interested in doing within breast cancer is really focusing on better understanding what causes breast cancer, with the idea that we'll be able to eventually or do a better job of preventing it. One area has been vitamin D, which people hear about a lot, but we've been studying it for quite a few years. And when we started studying it, it was still quite a new area. And because it's a new area, and it's something that we could potentially fairly easily change. So we've been doing a lot of work in that area to see if we can get any evidence that it really can help you reduce your risk of breast cancer. The goals really are to try and find better ways of preventing breast cancer. So especially, things, what is it we can change? What is it a woman can change that will reduce her risk of getting breast cancer, or in some cases getting a second breast cancer if she already has one. And donor support, which supports the Institute, really supports our research, and it's pretty critical for us to have a positive environment for us to conduct our research.
At Mount Sinai, we've developed a tool we call Dynamo that analyzes dynamic networks of molecules in tumors, and we can use these dynamic networks to predict breast cancer patient outcome. With the discovery of the Dynamo tool, we're able to deliver on the promises of personalized medicine, in that we'll be able to treat patients specifically to their particular disease. So it'd be the right breast cancer treatment for that particular patient. Without the help of donors, none of this would have been possible. Research is a long and difficult road, and it's always great to have the support of donors to help every step of the way. I have practiced yoga. I'm fairly tall. It doesn't necessarily suit my kind of body, but I have enjoyed yoga. I've sweat a lot and bent a lot and struggled a lot in the little yoga that I have done.
Thank you.
Thank you.
Thank you.